Thank you, everyone. I'm Yang Li, and I would like to share with you the caesarean scar pregnancy, CSB multiple diagnosis and treatment thinking. So CSB is a kind of an ectopic pregnancy in which the fertilized egg is implanted in the scar of the previous caesarean section, which is limited to early pregnancy. And with the change of the family planning policy, one-child policy to two-children policy, so as the OG physician, we come across this kind of disease more and more. So in these cases, vaginal ultrasound is the first choice for the diagnosis of CSB, sensitivity of 84.6%. So the endometrium was clear, and the gestation sac could be seen clearly under the vaginal ultrasound, and all these diagnostic criteria, and with the combination of MRI diagnosis, it can help us to calculate the thickness, the myometrium at the scar attachment. So we can have this different classification based on the growth direction of the gestational sac and the thickness of the myometrium between the gestation, the bladder. So we can have different ways of treatment, like methotrexate or UAE. And the traditional way is the temporary blockage. So it will increase the risk of the uterine cavity adhesion or the dysfunction of the ovary. So we can also consider about the HIFU treatment to treat CSB. So use the mechanical and the thermal effects of ultrasound to reduce the blood supply of the scar. And the second day, or even on the same day, we can conduct the curettage after the treatment. So indications for HIFU treatment is type 1 and type 2 CSP with vital signs stable and vaginal bleeding normal, and refuse to intervene in patients with reproductive needs. And these are the indications for HIFU treatment. So low pain, low cost, and no risk of premature ovarian failure and intrauterine adhesion and other thrombolism. And some other CSP indications, you can see the honoring curettage under ultrasonic monitoring or under hysteroscopy, removal of the pregnancy material, or laparoscopic pregnancy removal. And we'll try to find the most suitable one for the treatment. So sometimes the one solution cannot cure all the disease or to cure the disease completely. So we should think out of the box to combine one or two or even three of these treatments. So the first case, 40-year-old female was admitted to hospital with the chief complaint of menopause for more than a month. The ultrasound showed the gestational sac was partially located as the incision of the anterior wall of the uterus without obvious protrusion, and the thinnest part of the muscle layer was about 1 millimeters. And the size of the gestational sac was 23 plus times 25 times 22, and there was no abdominal pain. So it is a type 2 of the CSP. So we offer HIFU plus hysteroscopy treatment. So the very above part of the slide, we can see that the ultrasound and MRI to evaluate the thickness of the gestational sac with the HIFU treatment. We can see the image before and after the HIFU treatment. So these data and information were collected So on the day of the HIFU treatment, we inject the maxitrate. And the second day, we clear the embryo by using the hysteroscopy. So you can see the color of this patient of the uterine cavity. And second case, so menopause for 2 months. So after ultrasound, we can see the bottom part of the uterine cavity after the ultrasound. So it's diagnosed as CSP type 2. And the different previous history, so 6 pregnancies and 2 births. So the patient has no fertility plan. So on this basis, we consider UAE plus hysteroscopy. So as you may see, the upper part of this slides, through the ultrasound MRI to evaluate the thickness of the embryo of the fundus. And the bilateral uterine artery and the left internal potential artery angiography and the camel embolization were performed in April, and hysteroscopic scar pregnancy embryo removal was performed on April 2023. So the operation was successful and with intraoperative bleeding of 10 milliliters. So, and the process is smooth with a good and satisfactory outcome. A third case, 36 woman with reproductive age and was admitted to hospital with the chief complaint of vaginal bleeding. So after the ultrasound, we can see that after the color Doppler ultrasound, the local area showed the mixed echo mass about big mass at the incision of the lower segment of the anterior wall of the uterus, where the anterior wall muscle is very thin. So it is diagnosed as a CSP type 3. So this patient had 5 pregnancies and 4 deliveries, and 16 years ago, 14 years ago, and 5 years ago, and 1 year ago, respectively, and with no history of dystocia and pupil inflection. So we try to reduce those risks. And this is the color Doppler ultrasound and the pre-operation evaluation. So interventions, we offer UAE plus laparoscopy, because by using these 2 solutions can lead less bleeding. So April 14th, we conduct the bilateral uterine artery angiography and the camel embolization, UAE, were performed. And 2 days after the laparoscopic uterine CSP embryo removal, because through the color Doppler uterine and MRI evaluation, so we decided to offer her this laparoscopy uterine CSP. So through these 3 cases, we can lead to the conclusion that we should strictly grasp the indications of caesarean section to reduce the incidence of CSP. And CSP should be detected and not diagnosed early, adhere to multiple diagnoses and treatment thinking, and formulate individualized treatment plan timely and appropriately. Thank you.